All right, Cynthia, this is the initial look inside your shoulder here. This is the cup side of the joint, and this is the cup side of the joint right here, and this is the ball side of the joint, and the cartilage surfaces themselves look very good. The biceps tendon's right up here, and you can see those air bubbles. We're currently underwater. That's how we do the operation. The rotator cuff is to our right. That reflection where the bubbles are, that's the rotator cuff, and that looks absolutely wonderful. That's what it's supposed to look like. Come down nice and smoothly to that articular cartilage there. The labrum is to our left, and that's a tissue that we're expecting is torn, and you can see some frayed edges right there. What we need to do is explore that a little bit more and see if that's truly pulled up. The rest of the labrum looks fairly good. That's that rim of tissue right there, and it comes all the way back up and around to the top there, and that's where the biceps comes off of. The ligament structures in front, there's the middle glenohumeral ligament. That's a normal variant right there. Normally it's, in most folks, it's a big sheet of tissue. You just have a cord there, but that's perfectly fine. Superior glenohumeral ligaments in the middle of the screen, just on the left side of the biceps, and that's a subscapularis, the front rotator cuff tendon, and it looks very good as well. All right, this is that labral tear. We've got a probe in here, and you can see the cannula through which the probe is inserted. This is the labrum right here, and especially in young patients, this labrum needs to be down. And we see your articular cartilage right here, and how we know that this is a true labral tear is that it's detached beyond the medial edge of the labrum. Medial edge of the cartilage there. And so what we need to do is put an anchor in there, and then pass that suture through the labrum, and then tie that labrum back down. But that's what a labral tear looks like, when you can actually pull that tissue up there, pull that tissue up here, and that's a true labral tear. There's that labrum, and we've now tied that down. This is where you had that hole before, and now we can pull up on this biceps tendon here, and that labrum doesn't come up at all. That's it, tied down there. I'm going to get this other tissue out of the way here for a minute. There we go. And that's the labral repair right there. That's a suture. It's got it tied down. It's nice and secure. I'm real happy about that. So I think you're going to do quite well. We'll get you back to lifting weights. And a little bit of everything else. But that is nice and solid. Nice and solid.